Hi, welcome to CAT Scan. My name is Kevin. I work here at West Boca Medical Center. I am currently in the MRI department as well as the CAT Scan department. I went to school here for X-ray. I graduated 2 years ago, and I'm going to tell you a little bit about our Somatome Sensation 64 slice CAT scanner. First, before I go into this, let me tell you, it's very similar to X-ray, the way the photon interacts with the atom. The difference being that in X-ray there's a cathode and an anode, and there's a projectile electron that creates the image. But in here we have, instead of one detector, as there would be in X-ray, there's 32 detectors. Each one gets hit twice, making it a 64 slice. Either the photon can scatter when it hits the patient, which we call Compton effect or scatter radiation, or it can be completely absorbed, which is called photoelectric, which creates the white on the image, the Compton creating the gray. And then when you differentiate the two, that's how you create the picture. Also, a lot of heat is dissipated when this interaction occurs, which actually it's 99% heat and 1% X-ray. So yeah, it works very similar to the X-ray tube. It's just in a circle surrounding the patient, allowing us to create a lot more images at once and not have any superimposition. We're able to take much smaller pictures, we call them slices, in here than as X-ray. X-ray would be just one anterior to posterior or lateral view, whereas in CAT scan we are able to take one image and then post-process we can reconstruct it into any plane necessary, sagittal, coronal, axial. So it practically gives you a 3D view of the part that you're imaging. Sometimes we use contrast. If the part that we're imaging needs to be accentuated a little bit more than normal, we either use oral contrast or intravenous contrast. We're very careful here when we check their lab work. We always make sure that they sign consent. We check all their labs, kidney function, creatinine, BUN, GFR. So Dr. Godfrey Hounsfield created the first CAT scanner in 1972, later winning the Nobel Prize for Physics for his contribution to the field of radiology in 1979. Because of these Hounsfield units and these filters that we use, which is basically windowing, we can differentiate contrast and density between the tissue, bone, and fluid. We're able to image the same body part but focus in on different aspects of it. For instance, the head, we can image the facial bones with a filter that we use, an osteo filter which we use, or in the same scan we can see the brain, different tissues, or even the arteries inside the brain depending on the filter or the windowing level that we use. For our protocols here, we use care dose, which allows us to give the least possible amount of dose to the patient that we can during the scan. It actually changes based on the size of the patient and what we're scanning. 120 kV is practically what we use for a brain. As you can see here, it shows the dose that you acquire on an average scan. It changes as the patient is going through. Scan time, 9 seconds, 5 millimeter slices, produces 33 images. So you're going to get 33 slices of the brain. It allows you to choose the protocols based on which area of the body that you're scanning, and then it inputs the filters and the windows in for you. It takes a topogram first, which is a scout, basically the same as an X-ray, and then it does a helical scan of the brain. We use this more for stroke alert and patients that won't be able to keep still. So if we don't use a helical scan and the patient's able to keep still, we use a serial scan, which is an axial or incremental, where the table will move slowly as the scan is being produced. We use a power injector when we inject contrast. It allows us to get images simultaneously as the contrast is being injected. If we were to inject by hand, we would not be able to get some of the images in time, such as a pulmonary embolism study. If you may, sir, would you please that back for me? First thing we do is we position the patient comfortably. Be comfortable. That's the most important part. The more comfortable they are, the more still that they'll lay on the table, the better you can acquire the scan. We use this light to position the patient. Make sure the line is going perfectly down the center of the head, and then we move him in to where the second line is right below the chin. Right there. I'm not actually going to scan Bobby because we practice radiation protection here at West Boca Medical Center, but I would put a shield on top of him, and there's one below him. So that was our basic overview of CAT scan. I hope you learned something, and stop by anytime.